Today's video we are going to be studying Introduction to Embryology, and here we have the outline of what we'll be discussing. So definition, importance, stages, developmental period, and lastly, when. Now if you want to know what that part of the video when is going to be all about, please watch till the end of the video. Now let's start with the first on our list, which is definition. Now embryology is a subset of anatomy. Okay, so embryology is sometimes referred to as developmental anatomy. Okay, so developmental anatomy. It is also sometimes referred to as developmental biology. Okay, now what exactly is embryology? Embryology is the study of the developmental processes that take place in an organism from conception to birth. Okay, a very straightforward definition. The developmental processes that takes place in an organism from conception to birth. Embryology is all about the study. Okay, so let's take a look at the importance of embryology. Why do we need to study embryology? There are numerous importance of embryology. For this video, we'll be considering just a few of them. Okay, so firstly, embryology provides us with the knowledge of development. Okay, so it helps us understand the developmental processes. Okay, knowledge of developmental processes. Now it answers questions like, when does the structure start to form, when does the heart start to beat, and all of those interesting things. Now embryology is also important because it's been applied in important fields like gynecology and obstetrics. Now with embryology, prenatal diagnosis can be made. So we have prenatal diagnosis. Prenatal diagnosis can be made in an embryo or a fetus rather, and we have things like fetal surgeries and inter-utero surgeries. Okay, so these inter-utero surgeries are performed on babies that are unborn. Okay, so when a congenital anomaly is diagnosed, a congenital anomaly is a fancy word for a birth defect. Okay, now when a congenital anomaly is diagnosed, the surgery is performed before the baby is born, and these things are able to be done because of the knowledge of embryology. Okay, so these fetal surgeries, inter-utero surgeries are performed to correct defects like spina bifida and a lot of other defects. There are different types of fetal surgeries. Okay, so we have the open surgery. Okay, this is me deviating a little, but we have the open surgery. This is an example of a fetal surgery. And so in an open surgery, the abdomen is open, the uterus is open, and then the surgery is performed on the embryo in order to correct the defect. And then we also have another very interesting surgery that is called the fetoscopic surgery. Okay, now in the fetoscopic surgery, it's a minimal invasive method. Okay, so a keyhole incision is made through the uterus and then the surgery is performed. So unlike the open surgery where you actually have an opening, a total opening of the abdomen and the uterus, in the fetoscopic surgery you just have a keyhole incision and the surgery is able to be performed on the embryo in the womb, and that's why it's called an in-utero surgery. okay, an in-utero surgery. Now, embryology, or the knowledge of embryology, is also very important because it is employed in circumventing cases of infertility. Now, infertility is a very interesting topic of discuss, okay, and infertility is actually a condition that is diagnosed, and this video would have a lot of deviations, but it's just good for us to know some of these things. Now, infertility is diagnosed in an individual. So if you are younger than the age of 35, so if you are 35 and below, so less than 35 years of age, infertility is diagnosed within a year. Okay, so if you are trying to conceive within a year, and you're unable to conceive within a year of regular unprotected sex, then an individual may be diagnosed of infertility. And if you are 35 and above, infertility is diagnosed within the period of 6 months. Okay, so if you are unable to conceive with regular unprotected sex within the period of 6 months, you are diagnosed with infertility. Okay, now there are different causes of infertility in male and in female. Okay, in male we have a cause of infertility in male is, for example, cystic fibrosis. Okay, now cystic fibrosis in male is results in birth of men or male children that lack vas deferens. Okay, now the vas deferens is a structure in the male reproductive system that transports mature sperm to the urethra, okay, for ejaculation. Now, men with cystic fibrosis are not sterile, okay, because they can still produce sperm, but they lack the vas deferens that transports the sperm to the urethra for ejaculation, okay. And there are various causes of infertility in women as well, okay, and some of these causes are due to ovulatory disorders. Okay, so we have a lot of ovulatory disorders. Another cause would be endometriosis. Okay, now endometriosis is a condition in which endometrial-like tissues develop outside of the uterus. Now, generally in the uterus, you have an endometrial lining. Okay, so if this is the uterus, we have an endometrial lining in the uterus that thickens and breaks down during menstrual period rather. Now, in a condition in which you have this endometrial-like tissues developing outside of the uterus is known as endometriosis, and people suffering from endometriosis usually experience painful menstrual periods. Okay, so endometriosis in women is a cause, or maybe a cause, of infertility. We also have cases of PCOS. Okay, PCOS is a shortened form for polycystic ovulatory syndrome, or ovary syndrome rather. Polycystic ovary syndrome. Now, in polycystic ovary syndrome, what happens is generally is associated with an abnormal amount of androgen. Now, androgen is a male sex gene. Okay, so people with PCOS usually experience irregular or sometimes missed menstrual periods, and because of this abnormal amount of androgen, they may have body hair, abnormal body hair, like facial hair and things like that. So these are some causes of infertility, and embryology actually helps us to be able to circumvent some of these infertility issues in some very special ways. Okay, Okay, now embryology also, as stated earlier, helps in diagnosis of birth defects before the baby is actually born. Next, we'll be taking a look at the stages of embryology. I would be considering the various stages of embryology, and the first stage we'd be considering is gametogenesis. Now, gametogenesis refers to the formation of male and female gametes. Okay, so this is the first stage of embryology. The next stage is fertilization. Okay, fertilization has to do with the fusion of the male and female gametes to form a zygote. Okay, so a zygote is formed in this process. The next stage is cleavage. Now, cleavage has to do with the repeated division of the zygote to form 2, 4, and 8 cells. Okay, 8 cell stages. And when we have from 12 to 16 cells, we have a morula. Okay, as we would go on to see in the next stage. Now, the next stage of embryology is the blastula stage. Okay, now in the blastula stage, the morula is filled with fluid. Okay, and this fluid come together to form a mass that forms the blastocyte cavity. Okay, and in this stage, we also have the formation of the bilaminar embryo. Okay, bilaminar simply means two germ layers, and the germ layers are the epiblast and the hypoblast. Okay, the hypoblast. Now, in the next stage of embryology, the epiblast would go on to form the ectoderm and the mesoderm, while the hypoblast would go on to form the endoderm. Now, the next stage is gastrula. Now, the gastrula stage is the trilaminar stage and the establishment of the 3 germ layers. Okay, so these are the 3 germ layers: the ectoderm, the mesoderm, and the endoderm. Now, the next stage is the neurular stage. Okay, neurular stage. Now, in the neurular stage, this involves the formation of the neural tube. Okay, and the neural tube would go on to form the nervous system. Okay, now let's take a look at the developmental periods. In embryology, there are 3 developmental periods. We have the zygote period, the embryonic period, and lastly, we have the fetal period. Okay, now in the zygote period lasts from the first week to the end of the second week. Okay, that is from fertilization to the beginning of, or rather to the end of implantation. Okay, so from fertilization to implantation. The embryonic period lasts from the 3rd week to the 8th week. And in this period, we have formation of organs or organogenesis, as well as the formation of body regions. Okay, now the last stage, which is the fetal period, lasts from the 9th week up until birth. Okay, and in this stage is associated with growth of cells, increase in the size of cells, hypertrophy, and then the increase in the number of cells, hyperplasia. Okay, these are the 3 stages that we have in embryology. Okay, the 3 periods, rather, the 3 developmental periods of embryology. Now, moving on to the when. Now, if you have stayed up to this time of the video, Thank you. Thank you for waiting. Now we have come to the when. In this part of the video, we are going to be studying a bit of the menstrual cycle and when development starts. Okay, so the when is simply when development starts. Now, development starts after fertilization. Okay, so after fertilization. And fertilization takes place approximately 14 days after. Okay, now let's pay attention here. Development takes place after fertilization, and fertilization takes place approximately 14 days after the first day of the last menstrual cycle, or rather the last menstrual period. Okay, so let's take it again. Development starts after fertilization, and fertilization takes place approximately 14 days after the first day of the last menstrual cycle. Now, why is this so important? This is important because this is the exact knowledge and the exact formula that is used in calculating the due date of pregnant women. Okay, so pregnancy usually lasts for about 40 weeks or 280 days. Okay, and you start counting, or we start counting from the first day. Okay, so when the woman comes into the hospital to check whether or not she is pregnant or to get her due date, the doctor doesn't ask her, when last did you have an intercourse? Okay, he simply asks her, okay, so when last did you see your period? When did you start your period last? And most times women are able to remember the first day of their menstrual period. Okay, and so it is this day, counting 280 days away from the first day of the last menstrual period, would be able to give an approximate date on when the woman would be delivering. Okay, so when she would be giving birth. Now, this doesn't end there. In the next few minutes of this video, we are going to be studying why this is calculated the way it is calculated. But just before we move on, it's good for us to take note of the fact of these two facts, and it is that ovulation, of course, is the release of mature egg, mature ovum into the fallopian tube. Okay, very straightforward definition. And an ovulated egg, or once the egg is released, it lasts only for 12 to 24 hours. Okay, so the egg is able to stay viable or able to survive for just 12 to 24 hours. Now, however, an ejaculated sperm is able to survive for 3 to 5 days in the reproductive tract of a woman. Okay, is able to survive for 3 to 5 days. Now, why is this so important? This is important because we will build on this knowledge in understanding what is called the fertile window. Okay, what we have here is an online period tracker, and we're going to be using this online period tracker in order to understand the fertile window and why pregnancy due date is calculated the way it is. Okay, now this period tracker has some questions. So, when did your last period start? Okay, so I'm going to be picking a random date. Okay, so let's go to August and be picking August 17th. Okay, so when did your last period start? August 17th. How many days did your last period last? Okay, so I would be taking 6 days. How long is your circle? So the circle that we're being asked for here is the menstrual circle. Menstrual circle is the period from the first day of the last normal menstrual flow to the day before, okay, to the day before the next normal menstrual flow, as we would see. So on average, the menstrual cycle lasts for about 28 days. So I would be picking 28 days. So last period started 17th, 6 days duration, menstrual cycle 28 days. Now I'm going to click on calculate my circle. Okay, interesting. So the calendar is out here. Okay, so this is the calendar. Calculate my circle. Now, the dates circled in pink are the period days. Okay, the period days. So now we have since the period lasts for 6 days, as I stated, the 6 days is just a variable. It lasts for 6 days. So from 17th to the 22nd, okay, from 17th to the 22nd, the period lasts. Now, the dates circled, or the dates highlighted in purple, are the fertile periods. Now, this is very interesting, and this is because from the first day of the menstrual flow, from the first day of normal menstrual flow, which is the 17th, okay, to 14 days after this day is the day of ovulation. Okay, so counting 14 days, so we would have, this is day 1 after the normal menstrual flow. So 18, day 1, day 2, day 3, day 4, day 5, day 6, 7, 8, 9, 10, 11, 12, 13, 14. Okay, so this is the day of ovulation, 14 days after the day of normal menstrual flow. Okay, ovulation takes place on the 31st. Okay, ovulation takes place on the 31st. Now, why is this so important? Now, notice the number of days we have for the fertile period. Now, what exactly is this fertile period? Now, this fertile period is also referred to as the fertile window. And on average, the fertile period or the fertile window is a period of 6 days. So 5 days before ovulation and the day of ovulation itself. Okay, but for this particular calendar, it makes use of 3 days before ovulation, the day of ovulation itself, and the day after ovulation. Now let's interpret this properly. So if this fertile window simply means that if the woman has an intercourse within this range of days, that is from the 28th of August to the 1st of September, she is likely to get pregnant. Now, why is this so? Okay, so as I stated earlier, the sperm and ejaculated sperm can survive for an average of 3 to 5 days in the reproductive tract of a woman. So if the woman has an intercourse on the 28th, okay, so she has an intercourse on the 28th. Now the sperm can last in her system for a period of 3 to 5 days. So she has an intercourse on the 28th, and in her reproductive tract, she now has ejaculated sperm, but there is no released egg. Okay, so the sperm lasts in her from day 1 of ejaculation, 28, day 2, 29, day 3, and day 4, the day of ovulation. Okay, so can you see that now that the ovum or the egg has been released, this sperm is still active in the woman, and so this sperm is still able to fertilize the egg. This also applies for the 29th and the 30th. Okay, now you ask the question, okay, so why doesn't it proceed onward? Why does the fertile period end on the 1st of September? The fertile period ends on the 1st of September because the egg or the ovum is only able to last for a period of 12 to 24 hours. Okay, and that would be on the 1st. So if the woman hasn't had an intercourse on the 31st, okay, the egg or the ovum is only able to last up until the 1st of September. So once the 1st of September is over, the egg or the ovum is not viable anymore, and so the sperm would not be able to fertilize the egg. Okay, now as I stated earlier, the due date for pregnancy is calculated from the last day, or rather from the first day of the onset of the last menstrual period. Okay, so the first day of the last normal menstrual period, which is the 17th. Now notice that for fertilization to take place, fertilization takes place approximately 14 days after this day. Okay, so now we know why the pregnancy due date is calculated the way it is. We understand what the fertile window is, and we understand how the fertile window works. I hope this video has been helpful. If you liked this video, please give it a thumbs up and don't forget to subscribe. Thank you for watching till the end. Bye.